Hello, everyone. DG Renee here, and I've got Dr. Mary Berge back with me. Hey, Mary. She's here to talk to us about some more mental health issues. We had such success with getting together last month to just kind of break the ice on the subject. And I'll remind you, Dr. Berge is a Rotarian, but also a clinical psychologist. And so she comes to us with a lot of experience, knowledge, and can help us translate that into our Rotary life, because our focus this year, one of the focuses this year for Rotary that President McAnally asked us to discuss, was how to reduce the stigma surrounding talking about mental health. And so this is just part of our little small effort to do that here online and connect with people and kind of give some advice. And so it's the very last day of Movember. Wait, what? November or Movember?
Movember.
Movember. But why, Mary? We had to look it up, y'all. We keep hearing about Movember and how it's something important for men. They grow their mustaches, they grow their beards to promote recognizing men's health issues and stuff. So we had to look it up. Movember started because mustache plus November equals Movember, because men, as we know, are creative as heck. And so they sandwiched those two words together and grew their hair out so that people could be aware of their health issues, cancers, and also suicides, mental health issues. So that's kind of what we're going to talk about today, since it is the last day of Movember. Let's talk about the dudes. Let's talk about mental health and men.
Sounds good. Great topic. So what do you want to know?
I think I'll let you kind of just do a little bit of basic coverage on some topics, and then we'll go into some questions. How's that sound?
Sounds great. Well, I think, a lot of people always ask, why do more women come to therapy than men? And I think that's really just a sociological issue more than anything. In our society, most men are taught to hold everything in, to never complain.
Be brave.
And, in fact, there was a 2019 study done by the Cleveland Clinic that surveyed about 1,000 men. And according to that study, those were all American men. And they said that 40% of those men were raised to not complain about health issues of any sort. And they found that about 50% of those men did not even engage in preventative health care, that they wouldn't go to the doctor for checkups, et cetera, routine. And that 72% said that they would rather do household chores, including things like cleaning the bathroom or mowing the lawn, versus go see a doctor. So I know it's shocking, right?
I mean, I would rather do that stuff than go to the dentist, so I get it.
I got a great dentist, so I don't mind. But yeah, so I think sociologically, men are taught to suppress complaining, suppress having issues, that they're taught that they need to be tough and strong. And so they don't complain, and they don't see it as normal for them to ask for help of some sort. But if they break a bone, they certainly will go see a doctor and have that bone fixed.
Maybe.
Maybe.
Rub some dirt on it.
But let's just say even that there's about 10% of the population that does seek mental health professional treatment. That's about, out of that 10%, 12% are women and 8% are men. So we're still seeing a disparity there.
Wow.
But that has gotten better. That has gotten better over the years. So we're starting to see a slight change in trend in men actually embracing the therapy that we're able to provide. And in my practice, I actually have a huge, unprecedented amount of men seeking therapy, coming to our office for therapy. In my private practice has about 15 clinicians, and we have a lot of men receiving mental health treatment. And my personal clients, I'm about 70% men.
Wow.
So
without delving too much into, of course, anyone's personal medical history, what are you seeing in general, in your experience? What are the issues men are coming to talk to you about? And this is, for me, more curiosity's sake than anything, because I know what women tend to, or what I and my friends have talked about why we went to therapy.
Yeah,
but I'm
absolutely.
curious. Is
I
it
kind of
different
looked
or
at
the
my
same?
clientele list over the last few years and I made a list for you. So we get a lot of referrals for men for anger issues.
Mhm. Oh,
Sometimes those are referrals, because their significant other asked them to deal with that, or perhaps they're in some sort of legal trouble and they have to deal with
okay.
it. So anger issues are one thing. Addiction, that could be addiction to anything, but there's a lot of sex addiction as well. Addiction to porn, things like that. Depression, of course, is one of our number one reasons for treating anybody, depression and anxiety.
Yes.
Family problems,
Mm.
insomnia is really, really common as well. Life transition issues, empty nesting, change in jobs, retirement. Managing stress is a huge component that I see in therapy. Relationship challenges is probably the number one reason
Wow.
men seek therapy. A lot of just feeling on edge, and of course, work-related stress and or work-related trauma, post-traumatic stress disorder.
That
I
was my
get a
next
lot of
question.
first
Yeah.
responders, of course, but that isn't the bulk of my clientele right now. But there is a lot of more trauma, I would say, that's work-related for men than women. Women's trauma is often different. But yeah, a lot of stress, a lot of.
And so when you, again, being personally curious, when you are approaching a client, do you have a different approach based on I'm sure their age, their, why they said they came and all of those things, but is gender a considered a reason that you would maybe change your approach, or is that a consideration for your approach
That's a great
when
question.
you're talking to a new
I
client?
think a good therapist will approach every single client differently,
Mhm.
based on their circumstances, their background, their culture, their gender, their religion, all of
Okay.
it. All of it is absolutely important in how you approach therapy with someone. So absolutely gender does play a role in how I approach therapy. Also, men have the expectation, just probably like women do, that if I come to therapy, I'm going to have to talk about my feelings. um, and
Yeah.
that's not easy for men because,
No.
again, our society tells them not to do that, to suppress their feelings.
I
So I
feel
don't
like
often go
society
into that.
tells us a lot of stuff like that,
Oh,
even for
yeah.
women,
Yeah.
tamp it down a bit,
Tamp it down a bit, right? Don't
right?
crazy, right? Yeah. So yeah, we get a lot of terrible messages from society, from family, from upbringing, from culture, from religion. All of these things play an important role on what we think, how we behave, how we relate to others, and how we feel, and how we function. So absolutely. So knowing a little bit about the client's background, taking into account gender, their situation. I absolutely approach every case independently, but I don't often with men start out like, how do you feel about that? Um,
Right.
I do often take a different approach. I think men have a better response to therapy when you align with them as a resource and tool. That, as I posted today on Facebook, I'm a resource, an expert in XYZ. I can be used as a tool, an expert at your fingertips at any time you want, to provide you with knowledge, skills, etc., that can make you a better man. That can make you, what was the bionic man thing? Better, stronger, more,
Right.
everything.
Right.
So
Right.
if you approach it that way, that this is a resource, this is a tool just like you would use at home. This is like anything that you would do in any situation. You want the best on your team. If you're playing softball or soccer or whatever, you want to pick the best people on your team. A therapist can be one of your best players on your team because we have expert details and knowledge about things that can improve their lives. So yeah, my approach is often different. And depending on, again, who the man is sitting across from me,
Mhm.
my style may even change, to meet them where they're at. I think that's very important in therapy, no matter whether you're a woman or a man.
Yeah. I feel like we're so similar and so different all at the same time. I know that's just the most Captain Obvious statement to say, but I'm an empathetic person. And so when I'm in someone's space, I vibe on, kind of how they're feeling or whatever. And there are times when I'm in the company of men or women, and I can tell when people are uncomfortable in their skin. I can tell when they're, having trouble feeling like they can express themselves, or feeling like they, can say what they really feel. And I kind of feel like being in therapy helped me unlock that a little bit. And I think that when we're working and I always relate everything back to Rotary, but when we're in our Rotary world, when we're in our little bubble, and we're dealing interpersonally with people in our club, I think understanding how our experiences and our perspectives and everything make us, see things in such a different way. I think that when we think of it from a therapeutic point of view, we can only benefit ourselves and others if we're looking inward and trying to figure out, ourselves. So therapy's helped me help situations because I can kind of see things from a different way now. I'm like, oh, this person might be experiencing this person might be experiencing this, and I can kind of change how I'm approaching something because
I think that's what the men that I work with have found as well, whether they were hesitant to come or
Yes,
resistant
it can be
initially.
a great tool.
Yeah, once they get involved and once they see that it's not what they expected, and they begin to receive some of the benefits that come with therapy, and they can see the changes that are happening and the growth that's happening for them, they often sit across from me on the couch saying, "Oh my God, this isn't what I expected.
It's
I'm
so
so
different.
glad I came. Oh
Yes,
my gosh, I can't
it's
believe
literally,
They
yeah.
say things like, "How did I not know this?
Right.
How come nobody tells us this stuff?
Oh, it's so great.
Because you haven't been taught."
It's it. And when I first started going to therapy, I asked my cousin who's in a child psychologist, and I was like, I don't, what do I need? And he's like, everybody needs a therapist. Everybody needs someone to bounce ideas off of, to gain confidence, to learn more about yourself, to approach things in a different way. And I think that sounds scary in the beginning, but when you start working with a therapist, you realize it's just like you have a teammate, and they're literally right there going, okay, here's how we could take the next step, or we could do this, but both of these things will work for you. And you're like, this is great. I
Yeah.
just feel like I have such an angel on my shoulder.
It is wonderful
It's a
with
navigation
you.
tool.
We're an asset. We're an asset. It's unfortunate that there's still so much stigma around receiving mental health treatment or emotional health assistance, relationship development. I mean, we can call it anything you want: life coaching, consultation. Change the name of it, anything, because once you realize the benefit to
Oh,
having
yeah.
someone on your team who can take a look from an objective standpoint and create a plan to assist you to reach the goals that you want, not what I want. I mean,
Right.
sometimes I have insights that might guide you, like, maybe we need to think about this, and you go, oh, maybe we do.
Yes.
Yeah, it becomes such an eye-opening experience, and the men who sit across from me always leave therapy saying they are so glad they came and got so much out of it. But again, the stigma of therapy, and I think
Yeah.
especially for men, is
Yeah.
stronger.
Yeah.
The statistics for depression, let's just talk about. The statistics for depression are very high for women, and yet higher for women than men. But yet the statistics about suicide, those are higher for men than women. So we're not talking about it. The men aren't talking about
Right.
depression.
Right.
The men aren't talking about their traumas. The men aren't talking about their relationship difficulties. They're stuffing it. They're being told to ignore it, or they're acting out in anger
Be
because that's
brave,
all
be
they've been taught
courageous,
to do.
be a man,
Hmm.
pull
And
up your
anger
pants.
actually is sort of the emotional response or reaction that is deemed okay for men. Again, society teaches, that that's okay. You're allowed to be angry. You're allowed to be pissed off. You're allowed to, fight even.
Express your anger, right?
Right. But to not, say
But
that
not
you're
a healthy
vulnerable.
way to deal with it,
Yeah.
because there are so many times where in the past somebody would say something would happen, and my reaction would have been so different before, because I wouldn't have had the confidence in myself to know what that person might be experiencing, why I was reacting that way. Just having the knowledge of being able to unlock things as they're happening in real time, to be able to say, my brain is doing this because of this. my hair on my neck is standing up because of it. If you can acknowledge those things as they're happening and kind of hold it together, it's you can actually slow motion your way through an experience that in the past would have happened in a flash and you would have reacted without thinking. And I think that that's a game changer for everyone. And if we could have a society that did that instead of that, it's okay to be angry and yell and scream. If we had a society that was like, it's okay to, hit pause and process the situation as it's happening. So nowadays, when something happens that makes me snap, I will actually physically say, I'm going to need a minute.
Yeah.
I'm going to need a minute.
So
and I take
you're
a minute.
talking about like managing your emotions and being able to tap into biofeedback of recognizing how this emotion comes up physically often first before we recognize it mentally, cognitively. And one of the reframes that I've done in my office when we get a referral for someone who wants some anger management treatment, we reframe that immediately to emotional regulation. Because just that's all we're talking about really is learning how to manage an emotion, a reaction in a different way, in a better way, in a way that's going to be more productive to communicating with your significant other. If you don't have management of your emotions and regulations, very hard to communicate. I would say communication skills is probably one of the best things to teach, and the thing that I have a lot of fun with when I'm doing couples work too. And I consider the men that are in therapy and couples work as part of my sort of statistics on who's seeking therapy. Because they're often the happiest that they've come, because they're learning how to talk to their spouses in a way that gets their needs met. They're learning how to communicate in a way that their partner better understands, and how to understand what their partner is saying to them without emotional dysregulation or reaction that isn't productive. And of course, I do a lot of intimacy work. So being able to provide couples and men with more expertise in the intimacy department always helps a relationship. So
well, and I think that that's key, because when you're, no matter if it's a romantic relationship or if you're dealing with interpersonal relationships in your life, if you can recognize understanding what the other person is feeling and where they're coming from, and like you said, that emotional regulation, we can't control the things that go on around us. We can't control what the world does. We can't control what people say, what they think, but we can control how we react. And that is the biggest lesson that I've learned in therapy, because I used to hear it all the time. I never believed it because I didn't have the ability to do it. Therefore, if I couldn't, no one can. So it doesn't exist, and it's a big lie. But I was able to uncover that fact for myself, and my relationship with my kids has changed. My relationship with my husband has changed. Everybody I know, I'm able to be more authentically me. And I feel like the men I know, the men that I'm surrounded with, when they are being their authentic selves is when they are happiest. But oftentimes they only feel comfortable being their authentic selves in certain places. And that's okay for anyone. Like if you're uncomfortable, you don't have to be yourself. But I see them in places where they could be being more authentic or being themselves, and they're holding back or they're acting a different way because of society. Because people that are in the room or in the situation they're afraid they're going to be judged or whatever. And I have felt that myself. But I think for men, it's so much harder because they have to be brave. They can't have emotions. They can't cry at a movie. Everyone, I love a man that knows how to cry at a movie. I think that and not everybody does, and you don't have to. I mean, that's one of those things. That's not a necessity, but I feel like if someone wants to, they should be able to without fear of what other people are going to think.
Judgment, right.
That judgment. And I think that goes back. That stigma surrounding mental health can be stigma surrounding how men behave.
Again, I also think that a lot of men, because they're not engaging so much in therapy as women, and so they don't talk about what happens in therapy as much, they don't have the knowledge of all the new techniques that we can use to rapidly help them achieve goals. For instance, post-traumatic stress disorder. I deal with a ton of post-traumatic stress disorder. And we're no longer using talk therapy. I mean, it used to be that you sat down, maybe even in a group therapy or one-on-one, you had to talk about the trauma over and over and over. And we're finding that that actually re-traumatizes patients in a way that is just so unproductive. So I
Wow.
use a lot of techniques that are more hypnotic like. I do hypnosis therapy. I have several techniques that we can use that can reduce the symptoms of trauma and actually restore the trauma in long-term memory instead of it sort of being spilled out in short-term memory, still stuck in
Wow.
short-term memory, where it can be effective in 1 to 2 sessions. So for men to know this, for women to know this,
Right. That
or for
it's
anyone to know
available, that
this,
it's out there, that it's
right? But
possible.
yeah, just to know that like I'm not going to have to sit there and talk for months on end. That
Right.
she's going to be able to help me address this quickly, and I'm going to be able to move on more effectively,
Right.
whether that be at work, at home, in my relationship, because PTSD affects every part of your life physiologically. Men with PTSD and women with PTSD are less healthy. They have a shorter lifespan. They have more suicides. You know, they're
Yeah.
less effective at work. The just things start stacking up. They become more irritable. You know, it's hard to live with. So when I especially work with men who have had work-related trauma, I work with a lot of first responders and military. Being able to impact that and change that for them in a matter of a couple of hours is just life changing.
That's incredible.
And then
Yeah.
once that happens and they leave, okay,
Yeah. Yeah.
I'll bet 50% of them come back to me and they say, you know what? That wasn't so bad.
Wow.
Can I also work on something else here? Like, you know, my relationship's not that great. And maybe I want to, like, can I talk to you about something else or this? They come back to therapy weeks later, months later, even the
Wow.
next year. So I get a lot of repeat customers based on some very short term, and again, especially with men, short term solution focused therapy that I can impact in a matter of hours. They will come back to talk about
Wow.
something at a much deeper level because they trust me and they see that it's a different kind of therapy than they expected, that I'm a resource, that I'm a tool,
Right.
that
Right.
it's
Right. Right.
that it's
Yeah.
something
That you're not
so
like touchy
different.
feely the whole time, asking
No,
all these personal questions
no,
and I want to know everything about
yeah.
you. Yeah.
Yeah.
That's
So
so
it's
valid.
interesting, yeah, and again, I'm seeing an increase in men, coming into treatment, and it's heartwarming, and it's gives me
Well,
hope.
I mean, and part of what we're doing now is trying to talk about it more in Rotary. So, I mean, 1.4 million of us around the world, we should be able to make a ripple effect. And I talk about it when I go to the clubs. I tell them if you can just start it here,
Mhm.
asking each other, "How are you?" And just like Gordon McAnally says, "How are you really?"
Yeah,
And then listen to the answer
yeah,
and
absolutely,
soak it in and talk
yeah,
about it. Be willing to talk about it. Don't just do the "How are you? Fine, bye." And
yeah,
so, we're in the military community. My husband was a Marine, and we've got kids in the military. So we're surrounded in our personal life with veterans, military members. We have friends whose son went into the military, came back from Afghanistan, and took his own life. And
mm,
it was a hard reality to I knew this kid in high school.
wow,
I knew him before he went into the military. We were friends, and our families, been friends. And so that loss, and the realization of 22 veteran suicides a day, it paints a picture that goes to exactly what you're saying
yeah,
about men being the most afraid because most of our veterans are men. Now, women are also losing their life to suicide, veterans, but primarily, percentage wise, it is men.
yeah,
And it is stigma, it is confusion, and it is a lot of it is fear of losing security clearance, losing
oh
their
yeah,
job, getting kicked out of the military, getting whatever. They won't, and they're the providers because that's the way our society is right now. That's changing. We have two income households. We have women that are, finally able to make the same wage, but still, the men are considered the breadwinners for the primary source in the society, and they're afraid of losing their job. They think that that's more important than their own mental health, and then it ends up that the mental health is the one that takes over.
Yeah,
And
yeah,
you know, when suicide's involved, then,
that's it.
you know, so I feel like it's that stigma, and I feel like it's that resistance to, and in some cases it can be, you know, I don't want to tell my life story, I don't want to get all touchy feely and squishy, and that, you know, is gross. But also that fear of the stigma, the fear of losing the job. Do
Yeah,
you see
and yet
that?
when
What
I
do you
do
think
see
that?
a man, especially I think a man who doesn't want to talk about you know, all their history and all that, but when I'm able to help them unwind some of that, and they're able to make some aha connections to like, oh, the reason I'm doing this, communicating this way, feeling this way, reacting this way, or having these issues is related to something in my history or related to my upbringing or related to it releases this this feeling that
Guilt?
there's something wrong with them. They're able, when they get that insight, insight is what causes someone to change. Insight is what creates power for someone. Insight is everything. So when they have that insight, they're able to actually start to make the shifts in behavior with therapeutic intervention and with suggestion. And they'll work really hard at it, really hard.
That's amazing.
Yeah,
I
and I
feel
mean,
like,
I think men are total go-getters usually. And when they want to tackle something, they're going to do it. You know, they're just gonna be like gung ho because again, they want to be strong and do it, you know, best.
right, right. Yeah,
And
do
the
the
men
best.
that I have worked with are probably some of the strongest, smartest, happiest, healthiest men because they are that way to start with, and that therapy only enhances that.
Yeah,
So, and
that's
I, you know, they're
incredible.
brave for saying, screw the stigma, I'm going in.
Yeah. I'm going in. No, that's valid. And
Yeah, so
I
that's
just am
kind of it in
so,
a nutshell, I think, you know. So here's to Movember and mental health for men. And
woohoo!
get your butts into therapy, guys.
That's right. That's right. The time is now.
We're a
And
resource,
really,
a
we
resource.
got how many hours left and then the month is over. So you got to do it now. Call your therapist. No, I think that this is a great message. Thank you so much for taking time out today to talk about
Happy
this.
to do it.
And
And I look forward to seeing you next month. New
yes,
topic.
and I hope we can change some minds and get some people wrapped around this idea, wrap their arms around therapy.
Sounds good, Renee.
Awesome. Thank you.
You're welcome. Bye.